right now from KTAB News, your local election headquarters. This is Big Country Politics.
So much for being here for Big Country Politics. I'm Travis Ruiz, and we do start with news from your local election headquarters. As early voting started this last week, we're tracking the latest in the race for U.S. Congress District 19. Here's KTAB's Marley Capper.
Election day is in just weeks, and the two candidates of District 19 are preparing. One of the big topics being COVID-19, and as one would expect, they had differing opinions.
At the front end of this pandemic, there were lots of things we didn't know.
So Arrington agreed it was appropriate to have some tight health protocols.
We didn't do a good job of maintaining the reduced effort.
Moving forward, Arrington does not want to re-shut down the economy.
It is completely unrealistic and irresponsible to say we need to shut the economy down.
Whereas Watson thinks it's the only way to eradicate COVID. The next big topic is right here in Abilene at Dyess Air Force Base and the B-21. Both candidates want to keep it secure here in Abilene.
In my first term, helped secure the B-21 so that for the remainder of the 21st century, we would have a bomber base.
I have served in the United States military. I know how important it is to have effective and positive military force.
And a hot topic in West Texas is agriculture.
We need to try to maintain the agriculture and the family farm.
So agriculture is important for reasons beyond just our local economy. We've got to be able to feed and clothe our own people and not depend on China or other countries for our very basic needs.
While Arrington wants to support the promotion of ag in West Texas, Watson wants to focus his support on small local farmers. Arrington wants to have balance between oil and renewable, where Watson says
we have wind and we have solar.
He wants to focus on capitalizing solely on wind and sun power to combat climate change. In Abilene, with coverage you can count on, Marley Capper, KTAB News.
Next, we move to our eye on Abilene, a new direct flight and a new airline soon departing out of Abilene Regional Airport. And right now, we're digging deeper into the status of the flight and if there are enough passengers. Here's KTAB's Jessica Rink.
Today, the only sounds at the airport are revolving doors and empty escalators. But the hope is that in just a few days, these halls will be filled with passenger voices.
It's October 21st.
A Houston flight landing in Abilene.
And it's one arrival that evening and one departure that evening.
But it could be filling less seats than expected.
We're about a third booked right now, a third of the seats booked on the first few days.
Don Green says they're a little disappointed with the numbers.
We would hope to be better than that at any time, of course.
But it's a trend all airlines are seeing during this pandemic.
People are waiting much later to book their flights.
And it starts with Abilene Regional's key customer, business travelers like Will Christofferson from First Financial.
We actually have more than 44 of our locations of First Financial Bank within a 100-mile radius of the Houston airport.
But in-person meetings now come with uncertainty.
Normally you'd schedule that flight as soon as you know that meeting is scheduled, and maybe it's 30 days out, maybe it's 45 days out.
And Green says it's pushing booking back.
You never know what next week, let alone tomorrow, will bring.
But it's not just the businessman that's stopping seats from being filled. Green says it's about breaking habits of driving to DFW.
We've done the work of getting United and the SkyWest here. Now it's up to the community to keep this service by using it. That's the only way we keep this in the long run.
All right, we're going to our eye on education, and the Wiley School Board approving a stipend of $500 to each staff member in the school district. The school board saying that they want to show their appreciation to the staff for all their extra time and the work that's been put in through this challenging pandemic school year. All right, we're just getting started here on Big Country Politics. Next, we hear from ACU President Dr. Phil Schubert on the increase in cases, plus our interview with Taylor County Judge Downing Bolls. We're back in 2 minutes.
Big Country Politics on KTAB continues.
Welcome back to Big Country Politics. I'm here with ACU President Dr. Phil Schubert. We're talking about some of the rises in COVID numbers that we've seen lately. What have you noticed here on campus as far as a rise in numbers?
Well, we've seen our numbers escalate over the past 2 weeks, which, while unfortunate, we wouldn't have wanted it that way, it's not surprising. So we've been expecting to hit a period of steady increase just based on watching other institutions and other colleges and universities around the country. We've seen that here locally in other school districts, both in the K through 12 arena as well as some of the other local private institutions as well. And I think we're seeing some of that across the state and the nation. So it may stand to reason that we're in an environment where we have seen an increase in cases, but I think we're very effectively managing that. And because we didn't expect to go the entire semester without a little bit of an increase in the number of cases, I think we're prepared and doing a good job of managing it.
What are some of those steps that you guys are doing to manage the situation?
Well, we have a lot of things that are in place. Of course, everything from ensuring that we can test our population here on campus. So we've seen a significant increase in the number of people that are requesting tests and that have shown some level of symptoms. That's a great value and benefit to us to be able to conduct that testing here. We have about 150 rooms or beds set aside on our campus and properties that the university owns to be able to handle the isolation and the quarantining that is necessary. When someone tests positive, they're immediately isolated. But we also conduct contact tracing, which we have about 20 licensed contact tracers here on campus that will go through the process of ensuring that we identify those other individuals that, while they might not have tested positive, have had contact with those who have, and they're asked to quarantine for a 14-day period. Oftentimes they'll choose to do that at home, but we also have facilities here on campus that will allow that, which means we coordinate the delivery of their food and meals and make trips to the store and different things so that they can truly achieve the goal of quarantine or isolation, which is to be removed from the community for that period of time. We've scaled back the number of events that we're hosting here on campus and certain social activities for our students, specifically with regard to intramurals, fraternities, sororities. So those are some of the steps we've taken more recently to try to get back on the right side of the curve, if you will. We've also been very adamant in reminding our community that while we started out the semester really strong and had a great experience with very few cases, it may be that we all needed another reminder to really ratchet back up that discipline and ensure that all of us individually are doing what we need to do to keep the community safe.
You mentioned you guys have facilities here on campus for people to quarantine. Do you know, or beds for people to quarantine? Do you know how many of those have been taken up?
I think we're using maybe a third to a half of the beds that we've identified, so we still have a number available should we need them. But all kinds of different situations. Some students are in places where it doesn't make sense to go home, maybe the geography of where they live, whatever the situation might be at home. If they have a member of the family who might also be ill or have an immune deficiency syndrome or something like that, then we're obviously wanting to take steps to allow them to do that here.
On campus, have you noticed a concern from students or faculty? Is anybody more I'm afraid to be here, or have you noticed anything like that?
I think is traditionally the case across different populations of people. Those who are older among our communities tend to be a little more nervous. I sometimes wish our students were a little more concerned than they are, but at the same time, they've done a great job, I think, of really trying to do what we've asked them to do. Having the number of cases, I think today's number is 118. Still represents a very small percentage of our community here, and so while it is up, it's still a very small fraction of the community, and I think for the most part people have done a good job, and there's not great anxiety on campus, at least currently.
I want to ask about attendance. Have you guys seen an increase or a decrease in people actually attending class on campus through this entire pandemic?
Well, of course, when we started out this semester, we had about 80% of our courses that were being delivered face-to-face in a traditional format and about 20% delivered online. So that online percentage was higher than it would be in a normal semester because we took many of the larger sections of class that could not be socially distanced effectively and turned them into an online environment. And so I guess in that regard, we have had, or we are delivering more of our courses online than what we had previously done, but we still have the majority of our classes being delivered face-to-face in a normal instruction environment.
In those face-to-face classes, what are you guys doing to keep students safe?
Well, all the students are 6 feet apart, and they wear masks, and we disinfect every classroom between every setting. So we're trying to take those precautions, and as well the professor is masked also.
Taking those precautions, do you feel like that has helped not to increase at such a rapid rate?
Oh, sure. I think all the things that we're doing, each both individually and collectively, are having a positive impact. So, you know, it's hard to isolate one particular strategy and say, well, this is the level of impact. But I believe that from a consolidated fashion, that all the things we've done, including the individual things that we're asking students and faculty and staff to do, have had a positive impact. Again, having 118 cases out of a community of more than 5,000 is still a very low percentage of our community. And I think if we hadn't been disciplined and weren't continuing to exercise these processes and protocols, that we certainly would see a higher number than 118.
Moving forward, is there a number of cases that it would take for you guys to shut campus down, or?
Yeah, I get that question a lot. There's not a number. We haven't identified a number. I think that what we've talked about is we look at three things. We look at cases, clearly the number, and the trajectory and the momentum in terms of where we've been, where we are, and where we might expect to be in the future. We also look at the second C is containment. They're all C's. So cases, containment. Containment really focuses on where are we with the quarantining and isolation beds. How effectively are we conducting the contact tracing? Do we feel that we're in a good place as it relates to testing inventory and our ability to continue serving the community as those cases increase? And then the third C is community, really looking at what our experience, how it compares to the broader community, both Taylor County, the state of Texas, and nationally, and also looking at other universities to see what their experience might provide for us in the way of benefits of their own road. And so we look at each of those three areas, evaluating our relative position with cases, containment, and community to the broader experience. And it's that whole piece, that whole picture, not just a single piece, that comes together to help us decide what steps to take next.
Awesome. I appreciate your time,
Great.
Dr. Schubert.
Thank you so much, Danica. And still to come here on Big Country Politics, here from Taylor County Judge Downey Bolls on his decision to allow bars to reopen.
Big Country Politics on KTAB continues.
And this last week, a big decision made allowing for bars to open in Taylor County. And here's our conversation with Taylor County Judge Downey Bolls on that decision.
Well, good afternoon, everyone. I wanted to take this opportunity to come before you and the public and to sort of explain what we did this morning in terms of our disaster declaration. We went ahead and extended that again for a period of 30 days. And as part of that, there was a provision in there that will allow the bars to open at 50% of capacity, in line with Governor Abbott's executive order number GA32. So I did want to take this opportunity and explain a little bit about what we did this morning and why we did what we did, and most importantly to let the folks know how this is going to affect them as we go forward. So let me talk a little bit about GA32 just a moment. You may remember that since March of this year, we have been dealing with COVID-19. It started out back on March the 13th when the governor of the state of Texas declared Texas, the entire state, all 254 counties, as a disaster area and made a disaster declaration saying COVID-19 was a threat to the health and safety of citizens throughout Texas. Okay? On the 26th day of March, the county commissioners put in place our own disaster declaration, and on the 31st day of March, we went ahead and specifically set forth the directives and guidelines that fell in line with the same directives and guidelines that have been established by Governor Abbott. So we have been working from those as we have gone through this process all the way since March. The governor from time to time comes in and updates his orders and his executive orders, and we do fold those into our ordinance so that it does look and present a unified presentation for the citizens so that they know exactly what is being called for. Now, when we first started out, you may remember some of those restrictions that were put in place were pretty far-reaching. There was a lot of businesses that had to alter their operations dramatically in terms of being able to operate and continue to serve the public. And this really was because this COVID-19 pandemic hit on the heels of an economic downturn that really was hurting businesses anyway. So these two items combined made it very tough on businesses out there to stay open and to operate. In many cases, many of them had to close down, alter their staff, terminate some of their employees, or perhaps reduce their size and operations. So since this summer, the governor has been working on trying to get Texas reopened, and this latest effort of GA 32 further amends some of the previous restrictions he had in place, and one of those deals with bars. Now, you may remember that a couple of months ago, the governor closed the bars out of fear that the proximity of patrons in those bars might be leading to the spread of COVID-19. So he did order those bars closed, with the exception of places such as restaurants where they did serve alcohol, but 51% of their revenue did not come from the sale of alcohol, and that's why they were allowed to continue to operate. The bar owners, as you might understand, were quite understandably upset about this, and they felt like there was a double standard involved. We did not get into the middle of that. We were acting on the governor's orders. Now, on Tuesday of last week, the governor issued GA 32. And what that did is to basically open to 75% occupancy most of the businesses and business establishments in the state of Texas, with some exceptions. One of those were the operation of bars. The governor did allow those bars to reopen with 50% occupancy. And he did put some provisions in place about how those bars are going to have to operate. And that's where we were today. When we received word of that last week, we did follow the governor's directives in terms of what we had to do. We contacted the Texas Alcoholic Beverage Commission. They wanted to know about the number of hospitalizations and the percent of hospital occupancy that is based on COVID-19 and a diagnosis of COVID-19. They have set the limit at 15%. If we were higher than 15%, we would not be able to open up our bars here in the county tomorrow. We were not at 15%. As of yesterday, we were looking at a level of 3.9%. So we are significantly below the 15%. That's what allowed us to go ahead and declare before the Texas Alcoholic Beverage Commission in a document provided to them last week that we were and have been below 15% throughout this crisis. And so that's what set the stage for this. They gave us the okay, and so effective tomorrow, the 14th, that is when the bars will be allowed to open at 50% capacity. Now, what we did this morning is the decision was mine to make. The governor gave that to me in his executive order, and that is because the county is a subdivision of the state, and the county judge is the presiding officer of the Commissioner's Court, is the one who would make that according to section 418.108 of the Texas Government Code. So that's why the decision was mine to make. The governor gave that to me, that authority to make that as the county judge, and county judges all across Texas will be making the same kind of decisions for their communities. I do want to stress that in making this decision, I did so for a number of reasons. We have had some operators of bars and some businessmen who are, again, in the process of getting bars and breweries and things such as that open. This has had a detrimental impact on those. It has been severely, very curtailed their operations. Some of them have expressed that they are in danger of not being able to open as a result of this. The governor has, of course, been trying to get Texas open as they're able to do so. This is, I think I speak freely in saying this is a leap of faith on his part. He's hoping that by opening it up to 50% occupancy, these bars will be able to operate in a safe manner, protect their patrons, and we hope that as well. We follow the numbers every day that we get. We get some from the health department. We get some from the trauma area that we belong into. We belong to Trauma Service Area D, and we look at their numbers and we see how many hospitalizations are based on COVID each day. They're a little bit numbered than the numbers that are broadcast on television, but these are the numbers that we look at where we get our numbers from. So we are below the 15%. My goal and my hope is that as we get these facilities open and these businesses open, that they can operate in a safe manner. We will continue to follow the numbers and see how they're doing. The Alcoholic Beverage Commission is the one who oversees the operation of bars in the state, and they will continue to monitor this, and we'll be following their reports on what they're seeing on the bars as well. As I did indicate this morning, I did make a comment regarding the operation of bars that lots of people go to bars, and they do so for lots of different reasons. Some people go because they like the atmosphere. It's a very laid-back atmosphere. It's a place where you can go and be among friends, and other people go for other reasons. Sometimes they want to have a more party-like lifestyle, and they go to bars. The restrictions that are in place here is going to be incumbent on the patrons of the bars and the operators of the bars themselves to operate in a safe manner, and there is still some specific requirements in terms of social distancing and being up and moving around in that bar that will have to be adhered to. So if we can do through all of that and do so in a safe manner, I think we can move forward with this, and hopefully in a month or two after this goes into effect, then that will allow the bars to go with a more higher occupancy rate. We're just going to have to wait and see regarding that. So,
all right, Big Country Politics continues right after this.
Big Country Politics on KTAB continues.
We love this next story. A 91-year-old man in Abilene votes for the first time.
I wanted to be counted.
For 91-and-a-half-year-old Humberto de la Vega, the first day of early voting brought in a very big first for him.
I went to my son's business. Him and I walked from his business down to the courthouse. We just stood over there with everybody else.
De la Vega voted in the presidential election for the first time Tuesday, something only possible after becoming an American citizen just last year.
I had my opinions and all that, but I couldn't vote.
And finally getting to put those opinions to paper was a pretty good feeling, says De la Vega.
I know I felt good. It felt a warm feeling. I don't know whether everybody feels that way or not. Maybe they've done it so often they don't think about it. But for me, it was a good experience.
The 91-year-old got his ballot in before his wife Georgia did this election cycle. Do you yourself vote?
I do, but I haven't yet.
Although she didn't seem to mind, as this year marked a big milestone for her husband.
It's been a long time coming, but I'm proud of him.
When asked how he picked his candidates, De La Vega says he went with his heart.
I don't want to change it, except for the good.
And chose whoever thought could make a better future for his family.
My 4 kids, I owe it to them and my grandkids and great-grandkids.
This first-time voter asks anyone running for office this year or in the years to come to do what he did before going to the polls and look inward.
To ask themselves, am I going to make a difference or am I going to add to the problem?
In Abilene, with coverage you can count on.
It's a privilege.
Mercedes Hernandez, KTAB News.
Love that. Congratulations. Thanks for watching Big Country Politics. We'll see you same time, same place next week.